Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Can an emergency room drug test you without your consent? The short answer is yes, sometimes, but the reasons why are critically important to understand. It's not about getting you in trouble, it's about keeping you alive. The main reason an ER will perform a drug test, often called a toxicology screen, without your direct permission is for medical necessity. Imagine a situation where a patient arrives unconscious, extremely confused, or having a seizure. The doctors have no idea what's wrong. Is it a stroke, a head injury, or a reaction to a substance? A toxicology screen can provide life-saving answers in minutes. Knowing what's in your system helps them choose the right treatment and, just as importantly, avoid treatments that could be harmful or even fatal when mixed with certain drugs. This falls under a legal concept called implied consent. In a true medical emergency where you are unable to make decisions for yourself, the law assumes that a reasonable person would consent to necessary, life-saving care. That care can include blood tests, scans, and yes, a drug test if it's needed to figure out how to treat you safely. Now, if you are awake, alert, and able to make your own decisions, you generally have the right to refuse any medical procedure, including a drug test. However, refusing might make it much harder for the doctors to diagnose and treat you effectively. But what about the police? This is the biggest fear for many people. Your medical records, including drug test results, are protected by federal law, specifically HIPAA. Hospital staff cannot just call the police and share your test results. For law enforcement to get access to those results, they typically need to present a warrant or a subpoena issued by a court. So, to be clear, the test is for treatment, not prosecution. It's done under implied consent when you can't speak for yourself in an emergency, and the results are kept private unless law enforcement goes through the proper legal channels. The hospital's priority is your health, not your legal situation. Understanding this difference is key to navigating a scary and confusing experience in the ER. Thank you so much for watching. If you found this information helpful and want to understand more about your rights in medical situations, please consider hitting that subscribe button and turning on notifications for more videos.